The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome back to the Dental Brief. So excited for our show today. We recorded the first episode with Dr. Harms, and we have her back on the show today. Dr. Harms, thank you for being here. We appreciate you.
Thank you for asking me. It's a privilege to be here.
Yep. And like I said, second recording. So I'm glad you're staying here. Our studio makes it so much easier for us. It takes a little bit to set it up. So I appreciate that. Last time you were on the program, we talked about leadership. We talked about maintaining teamwork, motivating teamwork. We really uncovered a lot from a 40,000 foot view. Today, I'm going to kind of pick your brain, or on this episode, I'm going to pick your brain about title on your website, the Dental Mediator. Right? It's pretty phenomenal. I'm going to ask two questions. I'm going to jump right in them, and I'll let you answer it or answer these in any order you want. First of all, how do you find a good mediator when you're stuck and you need help? And then the other question is how do you avoid never needing a mediator or hoping to never need a mediator? So I know there are two big questions. You pick which one you want to start with, and we'll go from there.
Well, I think unfortunately we don't really have a lot of dental mediators. The reason I'm a dental mediator is I became a mediator when my daughter asked me to work with her law firm, and they needed a mediator, so I took that training. I also worked for many years with the American Dental Association as a national spokesperson, so I was able to look at two sides of many different issues, which really got me started. So there are mediation services that are typically listed. Civil mediators is typically, that's why I'm a civil mediator. There are many mediation services in each state, but unfortunately not many dental mediators, which is really kind of an unfortunate thing. What was your next question? You asked me another one.
So how do you avoid ever needing a mediator? But let me keep you on that first question a little bit.
Mhm.
I know a lot of people may be hearing this and going, "What? I don't understand a mediator." And I know there's a lot of things that can be mediated. Really, any issue that two people can't solve on their own, mediation is a way to potentially solve that issue. I'm sure there's a better definition to that. But the way that I've seen it from our position, our practices that we've worked with or about to work with, who are breaking apart because there's two owners or more that have been in some type of a business agreement together and relationship together, and it has fallen apart. It's like a divorce, um,
Yes,
except
absolutely.
it feels worse. Right. So I've seen it happen on the business side of things. I've seen it happen on the family side of things, and they're both horrible. But um, how do you avoid getting there? How do two dentists or more avoid ever needing to contact a mediator?
There's the first thing, which is a general thing about not needing mediation, is that when you are in a conflict, you need to focus on the problem and not the person. And quite frequently, we are upset with somebody. We're angry with someone. We assume that what they're going to say is going to be horrible and they're out to get us. I mean, we do that. Look at if you just watch the news and you're looking at two different, our country right now, two different sides.
Sure.
Typically, many times they'll talk about the people instead of the issue. Instead of saying, well, here are the pros of the issue, here are the cons of the issue. Let's look at those. They'll say, this person's horrible and this is what they're doing. We have to look at the issue itself and try to solve it. Take the person out of it, try to just distance that person out of it and deal with the issue. One of the other things I think for dentists, because I worked with dentists who are divorcing, unfortunately, within a practice, one of the things you have to look at is your contract when you start out. When you are joining together as a practice, you have to very clearly delineate how do who gets the new patients? What percentage of the practice do you own? What how do you get paid? I recommend some sort of a hybrid payment system, for instance, where it's not just 100% production; it's part ownership, part production. Because what if you become a partner with someone and all of a sudden they take a 6 week vacation and you're there working full time and they get half the payment? I mean, those are the types of things you have to really
Right.
work through before you come together as a team.
Yeah, if there's a
But if
compensation agreement in a business contract, right? If it's just, hey, we're 50-50 partners, one of those
Yeah,
partners can literally leave the practice, never walk into the practice again, and be expected to
exactly.
50% or half of the net profits of
Yes.
that practice, correct?
And not only can they do.
Right.
They do. And sometimes, I mean, we've seen things where you know, I hope that I'm taking the person out and not the problem,
Sure.
but sometimes you wonder if they are, that they're planning on that, but
Yeah.
and then if that thought ever enters your head, it's really hard to take the person out of the problem.
Right.
But yes, that happens quite a bit. So you have to have a fair, and you have to put into place what happens if someone can't work for 6 months or 3 months, or what's going to happen, and you decide that before it happens, so that
Right.
it's both sides decide this is how you're going to do it.
Sure.
So I think that a good contract. So make sure you go to a lawyer who's licensed in your state, who can do this contract. And there are many dental lawyers all over the country. I mean, try to get one that knows dentistry a little more specifically, so that they can watch out to make sure things are covered.
Yep. So let's talk about the legal representation side of things. And this really goes from transitions, right? So,
Mhm.
in real estate agents in this country, if people don't realize this, have a fiduciary value that they have to uphold, correct, to their clients.
Right.
But there is transition brokers, while I believe they should, they legally don't have to uphold anyone's best interest, correct?
Yeah, unfortunately, there's not a lot of regulation throughout the country for dental brokers. We live and the interesting thing is that every state is different. In our area, we manage the Midwest. There are some states where typically it just tends to be the accountants that tend to be the brokers. In some states, it's people that are not licensed at all into anything, that have just kind of gotten into it, maybe through real estate, that become the brokers. Minnesota tends to have lawyers that are brokers, and so I see the benefit of that. And actually, the wonderful thing is they all get along. And so because sometimes if they're brokering, if they're selling a practice and the buyer comes in, they'll you need a lawyer to work with the buyer, so you need several lawyers to work in all of these different areas. But the other thing too is, if you get a broker that's not an attorney, take a look at the full cost, because you still probably, depending on your state, are going to need an attorney to draw up the documents.
Right.
So if you're getting involved in buying a practice, selling a practice, take a look at the credentials of the person you're working with and any additional costs that might be in there, because
Right.
that's a surprise to many people, that okay, I'm spending this money for the broker, and then whoops, I've got to spend this other money to have all my contracts drawn up. So you just have to be very careful.
I know it's not always the case, right? I can hire a lawyer to represent
Yes.
somebody else. I can do that. They don't represent me. They hire that person, and that's very clear. But typically
Right.
in transitions, whoever's paying for the lawyer, that's who the lawyer is representing, correct? Typically, not always.
Oh my goodness, thank you for bringing that up. That's a huge problem.
Yeah.
Absolutely. If many times a lawyer, and we see this more across the country, many times people will say, "Oh, well, this is the broker for the practice, so I'll just work with him." And I guess it's probably similar to when I buy a house. I buy a house, and maybe I don't have my own real estate agent, but I'm using another real estate agent. They draw up all the papers. That real estate agent is representing the seller, and the lawyer, or the broker, is representing the seller, if that's the person who hired them. So whoever's paying the lawyer or the broker is the one that they're representing. They aren't representing you, and you have to have somebody represent you, because you
Right.
are kind of, when you're signing up to become a partner, to get involved in a practice, you're moving to an area, you're making a huge commitment. And if there is a divorce, it is a messy divorce. It's a miserable divorce. It takes years to kind of recover from that
Yep.
sort of thing. Not to mention starting your production over again in another area if you have to.
Right. And here's the value of hiring a lawyer or any expert that is experienced in the industry, is they know what questions to ask that you're not asking, right? So if you could go to the best lawyer. I know a couple of lawyers are amazing, brilliant lawyers, great top law schools, right? But if you ask them, hey, what should be in a dental, in a practice, between a contract between two dentists, they don't know, right?
They
They
don't.
really, because they don't do it. It's not what they do. It's not their area of expertise. So if you hire them, or your brother-in-law, or your sister, or it doesn't matter who it is, or someone you find that advertises a great price on the internet, If they don't know the industry, they don't know what questions to ask. And if you're not telling them what to put into contracts, they're not going to end up there, correct?
Absolutely right, and
Yeah.
things like covenant not to compete, accounts receivables, and what do you do with those? What do you do with patients when you've just sold the practice and the person comes back that the former dentist did a procedure on, and do you do it over at your own cost? Does the other dentist do it over? There's so many small, what might seem like smaller areas in the contract, but they have a big impact if it happens to you. We had one. I remember one lawyer that was representing one of client that was on the other side of my daughter's. I think he was a seller, and he was promoting a covenant not to compete in the shape of a semicircle, where so only one side of the three. The 15 miles, which means that the dentist was planning on opening a practice up like 2 blocks in the other direction. And the client that my daughter ended up getting and helping had not hired an attorney at first and was kind of going along with that because he was an associate. He was kind of going along with that. And as it turned out, as you know, if you're buying a practice and the dentist opens up next door and you bought a lot of goodwill, you've paid for nothing
Right.
because it's the dentist going far enough away that they'll come to you, which is the value of the practice. And that's probably one of the best examples. He almost did that. He almost signed a contract with a semicircular covenant not to compete,
Yeah.
but fortunately did not.
Yeah. I want to, and I don't I don't like fear mongering at all, but I'm going to
Mhm.
do a little bit of it here because I think it's that important. So, know
Mhm.
your mediation. Unfortunately, you have a lot of experience with this. I'm sure you've seen a lot of stuff that you wish you weren't involved in,
Mhm.
but you're doing your job. Appreciate that. Um, I've seen this happen where, and it happened with some clients of ours years ago, where two really healthy or what seemed financially healthy practice, both doctors are making a bunch of money. Patients are happy, team's happy, everything is going great. And something happened, and it led to this escalation that led to lawyers getting involved. And a judge pushed it to mediation. And then what ended up happening is we got a call one day, and I can't remember all the legal terms. We got a call one day from somebody the judge had put in charge of the assets of the practice and wanted us to answer all of these types of questions. And we did. They're trying to figure out what assets are what. And they basically froze the business. If this person from the
Mhm.
on judge's order froze the business so that nobody could take assets or steal assets. And this all clears up. It takes years and it all clears up. And one of the two partners called me and asked us to help him with something. And I asked him, like, I know it's none of my business, but what happened? How did this? And he goes, it just escalated and it got personal. And I said, well, what started it? And he said to me, I don't remember. I said, I don't remember. So when I get to the fear mongering part of things, a judge actually had to take control of this business at a period of time. I mean, they basically lost everything the business was worth on top of lawyer fees. So getting with the right legal help can help avoid a ton of pain, heartache, financial loss, so on and so forth. So if you have a contract that you're looking at, right, and somebody wants you to sign it, I understand that you maybe have some fear about, hey, I want to have a lawyer check with this because that feels very impersonal. It feels like you're not trusting that person. But the fact of the matter is they have a lawyer. You should have one too. Would you agree with that? Yeah.
Absolutely, absolutely, and we've seen the consequences of not doing that. Another example we just had recently was a person trying to get out of a partnership, and part of it was because it was supposed to be a 50-50 partnership, but somehow in the contract, but she did not get an attorney to sign it. Um, he had gotten the selling or the selling partner had gotten 51%
Mhm.
of the ownership. So basically, she bought half the practice but had no say in it because
Right.
she was only 49% versus 51. It's a very small little piece of the contract, but an attorney would have caught that in a heartbeat.
Yeah. Yeah. Dr. Harms, thanks so much for being here. We really appreciate it. I want to encourage our audience, give your firm a call, reach out to Dr. Harms, reach out to the entire legal staff. drkimberlyharms.com, I know, is one of the websites. What's the other website? What's the main law firm website?
The pinelakelawfirm.com.
Pine Lake Law Firm. Yeah. So thanks for coming on here. I appreciate you.
Thank you very much. It's been a pleasure.